We see overactive bladder in all age ranges and groups across both men and women. If you look at the entire Canadian population, it's somewhere between 11 to 13%. But when we break it down decade for decade, it's really those patients, men and women over the age of 60, 65, where it becomes much more common. In fact, somewhere between 25 to 30% of adult Canadians have an overactive bladder, regardless of whether they're a man or a woman.
Is it overactive bladder? You're not alone. 3.3 million Canadian men and women live with OAB or overactive bladder, often in silence and embarrassment. Today, we speak to Dr. Dean Elterman, urologist at the University of Toronto, to learn more.
The main symptom of overactive bladder or OAB is really urinary urgency. So that's the sudden desire to go to pee, and it's difficult to delay or defer going. Associated with urgency is also frequency, meaning you have to go many times in the day. And the third symptom of OAB is nocturia, or nighttime urgency. So essentially, you're awakened from sleep with the urge to urinate.
OAB may affect an individual's well-being, leaving patients feeling frustrated, anxious, and embarrassed.
It really has a significant impact on patients' quality of life. If you have urinary urgency, where all of a sudden you're going to have to try and find a bathroom, you're really going to be concerned about leaving your home, wondering where the next closest bathroom is. A lot of patients say that they don't want to go out and interact socially, go to friends' houses, theater or restaurant, just because of the fear of maybe even having an accident of incontinence or just not being able to get to the bathroom in time.
OAB impacts overall health as well.
Overactive bladder really impacts multiple domains of health and wellness. We know that patients are concerned about social interactions. They also may not want to exercise or go to the gym because of a fear of having a leak. We have one concern particularly with elderly patients, because if they have to wake up in the middle of the night with the urgency to go pee, they're at increased risk of falls and fractures, which is a serious complication in an older individual.
The good news is that OAB can be controlled. Some people may find some relief of their symptoms by making lifestyle changes.
So the cornerstone treatment for overactive bladder is really what we call conservative or lifestyle modifications. So these include pelvic floor physiotherapy, reducing caffeine, reducing excess fluid consumption, and these can really control symptoms in a large part.
Beyond lifestyle modifications, treatment options within OAB have expanded. Patients who are experiencing symptoms which impact their quality of life should consult their doctor.
One of the things that is often a misconception about OAB is that it's a normal part of aging. And as you get older, people just accept that they should get used to having small leaks or accidents of urine or not being able to hold their bladder. There are excellent treatments available, from pelvic floor physiotherapy and lifestyle modifications, all the way through to new modern medications that are easy to take with low side effect profiles that are very effective. There are a number of patients who will not respond to both first-line lifestyle modifications as well as second-line drugs. And in these few situations, we do have surgical interventions that are available. So if you think you have overactive bladder, urgency, urinary frequency, or nighttime urgency, really go talk to your family doctor or healthcare professional. The most important message I want to convey to Canadians about OAB is that it's a common condition. There's nothing to be embarrassed about. It happens more and more as people get older, but you don't necessarily have to accept it as a natural part of aging, because there's no need to suffer in silence. There's no need to have this negatively impact your quality of life. You can get better very quickly just by talking about it and seeking the appropriate care.
Men and women who are concerned that they may have OAB may visit the website overactivebladdertest.ca. To learn more about OAB or any related symptoms, please speak with your healthcare provider.